Hi everybody and welcome to our video series on basics of MSK physical exam. A tiny disclaimer, these videos aim to complement the content seen in class and thus are not meant to replace any didactic material. Nonetheless, enjoy the watch. Shoulder palpation is an important part of the physical exam. From the front, you can start at the sternoclavicular joint, go up the clavicle up to the acromion, palpate all the borders, and then on the side, you can compare the acromion to the humeral head to see its alignment. Then from the back, you can follow the scapular spine up to the medial border, appreciate the superior and the inferior tip of the scapula, and then you can compare both sides for symmetry, and also evaluate the distance from each scapula to the spine, again to look for symmetry. Palpation continues with the muscles, so you can start with the sternocleidomastoid that goes from the mastoid to the sternum and the medial part of the clavicle. Then you can continue with the scalenes, which are vertical in the middle part from anterior to posterior in the neck. Afterwards, the trapezius, which is a triangle that goes from the upper neck to the shoulder. The pec major, which is in front on the breast and then reaches the shoulder. Pec minor, which is right underneath. And then you can also palpate the long head biceps tendon that is in the intertrabecular groove and appreciate as well the muscle bulk. Palpation continues on the side with the deltoid muscle, which is the V shape that covers the shoulder, and continue with the triceps, so you can follow the triceps body up to the posterior glenoid, which is the attachment of the long head of the triceps. From the back, you can palpate the rotator cuff, so the supraspinatus, which is in the supraspinous fossa. You can palpate it all the way to the shoulder. Then the infraspinatus, which is in the infraspinous fossa. And finally, the teres minor, which is on the lateral border of the scapula and reaches the lateral part of the shoulder. At the same spot is the teres major, which goes to the medial humerus. You can also come back to the trapezius, but also the levator scapulae, which comes from the superior angle of the scapula up to the neck. In between the scapula are the middle trapezius, lower trapezius, and the rhomboids. This marks the end of our short video. Feel free to contact us for any suggestions or comments. Thanks for watching.